He is the co-founder and chairman of the Foundation for Research on Equal Opportunity. He is a senior contributor at Forbes magazine. And, very important for us today, he was the healthcare policy advisor for Mitt Romney's 2012 presidential campaign. Avik, thank you for being with us today. I'm going to start with what I asked Dr. Emanuel. Skyrocketing costs. Republicans say it's because of Obamacare. Democrats say it would have been worse without Obamacare. What do you make of the explosion in healthcare costs over the past 15 years?
Well, Chris, Zeke is a friend of mine. He's a very smart guy. But when it comes to Obamacare and the cost of health insurance, he's totally wrong. So when Senator Obama campaigned to be president in 2008, he went around the country and promised every American that if you pass my health care reform, the average family of four would see a reduction in their cost of health care by $2,500 a year. That's what he promised over and over again on the campaign trail. Here we are now, 15 years after Obamacare passed, and the average family of four that has to buy insurance under Obamacare is spending more than $10,000 a year than they would have spent before Obamacare passed. So in 2013, the average insurance plan that's like an Obamacare Silver plan was about $232 a month. Now it's like $625 a month. It's nearly tripled. And the deductibles have more than doubled. So people who were promised so-called affordable care under the so-called Affordable Care Act are finding health care to be less affordable every year.
Is that because of Obamacare, or is that because of other factors that are substantially unrelated?
That's a great question, Chris, because of course healthcare has gotten expensive overall, not just for people under Obamacare, but the rate of increase of the cost of health insurance under Obamacare far outpaces what it is for the rest of the market. So for example, if you get insurance through your employer over that same time frame, the cost of insurance has increased by about 50% or 55%. But again, for Obamacare enrollees, the cost of insurance has gone up by 179%, nearly tripling.
Okay, so part of something you've been working on for a long time is to get Republicans to talk about the replace part of repeal and replace, right? And as Obamacare became more popular, it became harder to repeal, and it especially became harder to repeal if there's no replacement. Now, do you think, or maybe test my theory, is this partly because healthcare hasn't been a Republican-coded issue? It took a long time, for example, for Republicans to get serious on education policy, maybe not till the 1990s. Is this sort of like that since this isn't something that Republicans put at the top of their stack, that it's taken them a long time to get around to this?
Well, that's such a perceptive question, Chris, because we've seen this over and over again. Whatever the issue is, you have to be willing to pay a political price to do the right thing when it comes to reform. Because there are going to be certain things you need to do to make a system better that involve overcoming the special interests and the vested interests that basically want to block any kind of reform. Democrats were willing to do that to impose their form of healthcare reform. Republicans have been willing to do that on tax reform and a bunch of other issues where they're willing to get criticized to do the thing they really believe in. And the problem in healthcare for Republicans is that not enough of them are invested enough in the issue to say, you know what, we're willing to pay a certain political price to get over the hump, especially after what happened in 2017, where they tried to pass a repeal and replace bill that frankly was kind of ill-conceived, and the end result was, they believe, they lost their majorities in 2018.
Okay, so now you got to sing for your supper, though we provide no food. If you could get a serious sit-down between the two parties, if we made you the czar and you could get all the decision makers around the table, what kind of law, what kind of replacement would you have them craft?
So we at the Foundation for Research on Equal Opportunity have actually produced a plan. We call it Medicare Advantage for All. It's basically universal private insurance, like Medicare Advantage, like a functioning Obamacare market. And in fact, it's been introduced in both the House and the Senate as the Fair Care Act. The sponsor in the House was Bruce Westerman and Jim Banks when he was in the House, and Mike Braun, who was then the senator of Indiana. Now he's the governor of Indiana. So there's a new version of that bill that's being worked on by members of Congress right now. Hopefully it'll be introduced pretty soon. But the basic idea is simple, and that is if you want to have a functioning, competitive, innovative, affordable healthcare system in which people have a lot of choice in both the insurance plan they have or the doctor they want to have or the hospital they want to go to, You got to start by having a market in which people buy health insurance for themselves. Right now, the vast majority of Americans, they have a huge middleman when it comes to buying insurance. It's either their employer who buys the insurance for them, or it's the government who buys insurance for them. They don't shop for it themselves the way people shop for car insurance or homeowners insurance. So you have to evolve the U.S. system into one in which people buy insurance for themselves. Obamacare kind of messed up that market, so we have to repair that market so it works better and there's affordable options for people to buy their own insurance. And when you fix that, the next thing you have to do is tackle the high cost of health care, the high cost of hospital care, the high cost of drugs, and also subsidize it less. Like right now, you and I and Zeke Emanuel, we're paying taxes so that the richest people in America can have government subsidized health care through Medicare and the employer-based system. Let's reserve our taxpayer subsidies for people who really need the help. Lower income people, the vulnerable, the middle class. Wealthy people should not get a subsidy to buy their health care. You fix that, and you fix the individually purchased market for health insurance, then you have a system that works.
Okay, what do you think about the Republican idea knocking around right now about a kind of health savings account that the government would set up, health savings account, subsidized for some, others it's available for people to pay into? What do you think about that one?
Yeah, listen, I mean, health savings accounts have their role in everyday care, like, an MRI scan or a mammogram or your prescription drugs. But if you've got a $100,000 health care bill, you got hit by a bus, you had a stroke, you have cancer, that health savings account is not going to last very long. So you still have to have insurance. So it's really important that we have a health insurance market that works. But again, to have a health insurance market that works, we should have a system in which every American has the option to buy their own insurance, fire that insurer if they don't like the customer service and go to a different one, instead of being dependent on their employer or the government to buy insurance for them. You fix that, and all those perverse incentives you heard Zeke talk about, those start to fade away, because the whole system has to focus on the patient and the consumer rather than the bureaucracy.
Avik Roy, we are very grateful that you are out there working on these questions and that you would take a little time to share your big ideas with us. We appreciate you.